Hello, everyone, and welcome. Hello, welcome to all participants who are starting to join in. My name is Lavinia, and I'm part of the Docsity team. It will be my pleasure to moderate this webinar tonight in partnership with emlyon Business School. For those of you who are joining, hello and welcome. My name is Lavinia and I'm part of the Docsity team. We'd like to know where you are connecting from. So while we are waiting for all participants to join, please pop in the chat your nationalities, your countries of residence, and so on and so forth. And we'll be glad to know more about you. So in the meantime, I would like to thank you for your interest in this event. So of course, this webinar will be dedicated to the prototyping of a digital healthcare solution by the Master in Health Management and Data Intelligence offered by emlyon Business School. So for those who are still joining, welcome, and thank you for connecting to this webinar. My name is Lavinia and I'm part of the Docsity team. And here with us tonight, we have some speakers on behalf of emlyon. So we have Florencio Travieso, PhD. He's the co-director of the Master in Health Management and Data Intelligence at emlyon Business School. Hello, Florencio, and thank you for being here with us tonight. We have Benjamin Dalmas. He's the co-director as well of the MSc in Health Management and Data Intelligence. He is here on behalf of the École des Mines Saint-Étienne. Hello, Benjamin.
Hi, thank you.
Thank you for being here with us tonight. And we have Charlotte Guirao-Cassan. She's the Marketing and Development Manager. Thank you, Charlotte, for being here with us tonight.
Thank you.
And finally, we have Uzma Faria. She's the Student Ambassador at emlyon, and I want to thank her for her presence tonight because it will be very valuable to have her insight on the student life at emlyon. So for those of you who are still joining, welcome everyone. We are here tonight for this webinar in partnership with emlyon Business School. My name is Lavinia and I'm part of the Docsity team. And of course, I want to thank you all for joining. While we are waiting for the last participants to start to join this event, I would like to remind you that you can interact with us by using the Q&A box. So any questions you have about emlyon Business School, about this Master in Health Management and Data Intelligence, you are free to type your questions in the Q&A box, and we will answer them at the end of this presentation. I also want to remind you that you can request your certificate of attendance by Docsity, and I will pop some more information about that later on in the chat. So for now, I will start by leaving the floor to Florencio, and I want to thank once again all of you for joining us tonight. Thank you so much.
Thank you, Lavinia, for the introduction and presentation, and thank you for Uzma, our student here present, and co-director Benjamin, and also Charlotte in charge of the admission process. All right, so I'm very happy to see all these people. I'm hoping that, as Lavinia said, you will be sharing your country or your questions. It's great to know where you're connecting from, because we will learn a lot, and we can also discuss many things. Okay, so and I am from France. I'm from France, but I'm originally from Argentina, so I can start sharing my origins too, if you want. All right, so we're going to do this. We're going to start by doing a brief presentation of the program and the pedagogical activities that we do, and later on we're going to talk about our solutions that we have developed this year, or ideas that we have developed this year on prototyping digital solutions, which is quite I would say exciting. We have done that, and a little bit of what we might be doing next year. So brief presentation on the schools that we have. Do you see the big screen, right? So
yes, I confirm. These
are our two schools. This program is a mix between basically the best of both worlds, we could say, because we are emlyon. I represent emlyon Business School based in Lyon, France, and Benjamin represents Mines Saint-Étienne. So emlyon Business School is one of the leading business school in France. It's a top 5 business school in France, and basically we have a very, I would say, very strong and very dynamic idea of teaching and doing and creating ideas in business, which is called this early maker approach. And this master, basically, this master of science, who has the goal of sharing our ideas on health management and data intelligence, basically is going to be discussing not only health management as it happens today, but also the importance of data, artificial intelligence, data science in today's industry. So I'll let Benjamin Dalmas, co-director and representative of Mines Saint-Etienne, to introduce himself, of course, and also to give this sort of approach of how these two schools and how Mines Saint-Etienne is important for this program.
Yeah, sure. So at Mines Saint-Etienne, so I'm a professor of artificial intelligence, so in healthcare. And for those who don't really know, Mines Saint-Etienne, in one of the top engineering schools in France, we do a lot of stuff related to engineering, from like physics, mechanics, materials, and biomedical and healthcare engineering is one of our specialty. Actually, we have a whole dedicated research center for these topics. And really the goal of this interaction, this combination of both business related content from emlyon and engineering, healthcare engineering from Mines Saint-Etienne, is to bring like a technical aspect, all right, like the core content of the innovations, of the technology development with, let's say, I would say the packaging, like how to make this happen in the real world, all right, with innovation, marketing, entrepreneurial skills, let's say. And really what we bring as engineers, as professors from technical areas is this wide spectrum of technologies, because we collect data, we produce data, and we use the tools to use as best as we can these data that you as future professionals will use as well, all right? So we bring this knowledge to give the students like the tools, all right, to be like ready when they will have to use these tools, okay, to answer real business questions, all right, related to healthcare that the different companies you will work in will, I don't know, provide, all right, to address a new market, a new population segments with the creation of new devices. So that's really the focus that we want to provide with you, is to give you the materials, give you the skills and the engineering tools, all right, to address these challenges.
Excellent. So one of the things that this program has, one of the characteristics that this program has, is that we introduce companies and they participate in the process, in the program, both like, as part of case studies, practical case studies. And you see here some of the examples. Some of them are like, very close companies, some friends, some very close partners. And basically, we introduce these companies. They participate with the examples, with case studies, and sometimes guest visits. They come and we do some visits. And this is basically the sum of many companies that we have seen in the last three years. If I have to resume or summarize the objectives that we would like, is basically we need to prepare people or students from many backgrounds, from different backgrounds. We have to prepare them for a changing industry. So the healthcare industry is constantly changing, and it's important to give them the tools, management tools and technical tools, to be prepared for these new challenges. So we talked about teaching you or guiding you to understand these new technologies, learn about regulations and compliance, in the market, learn how to manage or control data intelligence or artificial intelligence, and also to learn a very vast collaborative, to learn to share your ideas with new students, such as group work and presentations. That's very important. We develop both hard skills, knowledge and technical knowledge, and also soft skills, which are important in business, because in the end, in the future, you will be able to deal and discuss with CEOs or CTOs and defending your ideas and presenting your ideas. So that's very important for us from a perspective of a program. And I'm going to ask our first question to Uzma, our student and school ambassador, to give us maybe how did you feel, maybe Uzma, the transition between being a student or a professional into the program, and what kind of was the I wouldn't say the shock, but the new challenges that you saw, the group work and the presentation and all these soft skills elements. How was this contrast in your opinion?
So basically for me, this course gave me everything new. All the aspects of the program, be it academics, be it soft skills, be it all the projects that we did, everything was new for me. And apart from the academia, we also learned the technical aspects in the second semester. So those were also the challenges which I faced, but it basically broadened the horizon. Before joining it, I was thinking only in one direction, but now I can see things in much broader perspective. So the healthcare system has so many aspects. Before this, I was not aware of.
A great answer, and you know, we like it. This is a view of our big auditorium, Julie Victoire d'Aubier in Écully, and this is one of the first day of class of our students a couple of years ago, and it's great that Uzma was able to summarize that sort of positive and 360 approach, because this is what we give to the students, a very wide approach in seeing not just technical, not just business, but seeing things in a very broad perspective. And it's interesting to discuss as well the origin of our students. We can have students coming from the as we say, the management or business side, with all these groups that you're saying, and also technical or more health or bioscience perspective. So when you could ask a question, say like, okay, do I have to have a public health background or an engineering background or a management background? No, most backgrounds are accepted as long as you have a clear interest in the program, as long as you have a clear interest in developing and taking your career a step forward, and also to as we always say with Benjamin, to be curious. We like people that are curious, and you will see in the second part of the presentation, I will try to speed it up, that our curiosity is shared with our students in creating or finding new paths and new solutions. So if I have to summarize, as we always say, we try to create what we call crossover professionals. It's a professional that is prepared to be a manager, a high-end manager, to observe the functioning of a business or a segment of a business unit through theory, but basically technical knowledge, management tools, a global vision, a dose of strategy, and this sort of like a little, pinch of early makers, which is basically what drives us to try new things and not be afraid of doing or testing new things. And I go back to Uzma to ask her, when did you become an early maker? And this is almost like a joke. When did you realize that you were doing things that you probably 6 months before you would not have, tried?
Yeah, so basically, right, if I trace back the journey right into the first semester, when we were given the project of the transforming early makers, I thought at the beginning I was clueless because it was completely new. I was not aware of anything. But as and when we were approaching, maybe like, let's say 2 or 3 months had passed and we had some concrete thing happening, the project was taking some shape. That's when I realized, no, I mean, this can happen, because 3 months back, we had zero idea about what we are going to do. And the thoughts were going all over. But yeah, after 2 to 3 months, it was taking shape and I felt that, no, it could be done.
That's the spirit of early makers. And let's do a quick jump into our main course this year, which was, we called it Ignite this year, because we decided to go to space, not literally, but go to space in our studies. And that was a very wild decision, we could say, And our students, and what Uzma was saying is perfect, because at the beginning they were probably, I would say, lost. It's like, how are we going to do this? You know, how are we going to manage these things? And little by little, and everybody was confused. And we said, okay, trust us, give us a little bit of time. And what we decided to do this this year was is discuss space health, and it was a crazy topic. And basically say, okay, we have the space, we have space exploration as a complete new topic in the world. And our idea was to say, okay, let's try to imagine what would be the digital healthcare solutions if we were supposed to travel to Mars, for instance, deep space exploration for 9-10 months. How are we going to? What will be the tools necessary to accompany the astronauts in this long journey into space? And we decided to discuss about basically behavior situations. How would astronauts react in space, and how could we find tools, digital tools or technology that would help us or help them to cope with basically stress, or being very tired, or being very nervous, or imagine that there's a leak in the space station or in the ship, and then you have to basically make quick decisions very fast. Now you may be thinking, why am I studying space if I'm on Earth? And probably like 99% of our students are going to be students and never going to be astronauts. But what we tried to play was the idea that yes, solutions could be used for space, but they are useful for Earth too. And many of the solutions that we use on Earth, of course, we use them on Earth, on space too. So that was the idea. And we were discussing these issues, cognitive performance. Also, we were discussing sex in space and reproduction issues, the impact of radiation, and of course, lack of intimacy, certainly, food in space, and nutrition in space. And finally, digital avatars, what we call, or basically remote control or remote control or operations from a distance, basically. Today, we could and sleep, of course. Today we could operate or do ask a surgeon to operate from Earth to the International Space Station. But then we could use artificial intelligence tools for guiding a surgeon or a non-surgeon in a deep space exploration environment. So there were so many discussions. And Benjamin, maybe you want to share the different approaches that we had from a technical perspective, because basically we started this project saying, okay, try to prototype some idea, and then we began to give them talks, and guests began to appear, right?
Yeah, how it goes, it's kind of, funny for us, because like the destination we're giving you here, like sleep in space, behavior analysis, seems like kind of unreachable for you. It's right from the beginning of the program. You say, okay, how am I gonna get there? Like the path to go to that end of project seems like a nightmare, and it's good because this is kind of the feeling that we are aiming at when we are giving you these crazy topics, okay, to push you into the bath without you knowing how to swim. Basically, that's the idea. And the goal is, like, little by little you will start getting familiar with the topic, okay, what it is, what's the big picture out of it. Is it only useful, yes, in space? Is it useful, and how could it be useful like on Earth? Is it some kind of related topics that we can handle with some particular populations of patients and so on? Exactly. And what we are doing through these 3 months, okay, the project starts at the very beginning and ends at the end of the first period, okay, around Christmas time. And we are giving you keynotes here and there, okay, to ignite, okay, some ideas, some content that say, okay, that might be useful for my topic, okay. I don't know, studying sleep in space. okay, this thing about sleep patterns, maybe this technology, lights, etc., could be useful for my idea. Okay, so how can I make this topic mine in terms of content, in terms of technology, in terms of marketing? How would I don't know, make this product viable, okay, on space, but also on Earth? Who will pay? What's the business value out of it, etc. So we will just pitch you every week some core contents to make you aware of what has to be addressed, okay, as particular matters, and also coaching sessions to discuss with professionals, like with guys that actually know the topic. Would it be on technology here on Earth, but also from, and this was the case this year, like guys working for space agencies to discuss, okay, is what I have in mind, is what we are designing kind of okay? Would it be useful? Would it be okay if we went to the end out of it? So that's the idea, basically, feeling like it's impossible, but little by little feeling that, okay, I can make a little change in that what seemed to be crazy topic. And at the very end, yeah, you will like it, basically.
We had guest speakers from the National Air and Space Agency from the USA. We had talks from university professors that work with NASA and with the European Space Agency. We talked to neuroscientists here in France and Lyon that came and also gave us thoughts, and also people that are in link with hospitals and new technology. Uzma, what was for you, in your opinion, the highest point of transforming Early Maker, this prototyping process this year? What was the wow moment that you probably felt? Hopefully there was one.
There are many, actually. One of, I would say, one of the presentations or the talks by our guest speaker, Mr. Graham McIntosh, that was the highlight of the entire TEM project. And he gave so many insights, because since he's working in the real world there, and he was generous enough to answer all our queries. So that was the highlight. And also we got the first-hand information from the hospital settings in Paris. So the trip to the Paris hospital, where we actually went and saw the innovations they are working on. And when we tried to link both the NASA lecture and the Paris visit, so these two were the highlights. We had to basically take insights from both and put our brains and then basically do our project.
That's great. And thank you so much. And maybe talking a little bit about methodology. This is the methodology that we used. It's called Biodesign. It's a book that, I mean, it's a methodology that is used in Stanford in the business school. And we realized that we were doing the same thing for a few years without knowing that there was an actual, formal methodology. So we were doing this. We were training or accompanying students to identify problems, identify needs, invent something, and then try to implement it, at least from a perspective of business deployment. And at the end, they presented a pitch with their presentation, with their ideas, and with their prototypes. I'm not going to go so far into this because students that candidates that are listening to us, they might be thinking, okay, but that was last year. So I'm not going to be talking so much about next year, but what can I tell you is that in our next year, we're going to develop a new, basically each year has a different topic, and next year's topic is going to be the modernization of hospitals. We're going to be saying, let's think of the hospital of the future, almost like this. Basically, that's going to be next year project. I don't want to say anymore, because otherwise we would be like damaging losing the surprise. But that's what we're going to be talking about. We're talking about how to redesign hospitals through digital technology. Let's go back quickly to a little bit of the academic content. Uzma mentioned there's basically three main, I would say, periods. The first period is the September through December, where we talk about basically we discussed transforming early maker track that we see there on the slide, and then we talk about the main introduction on artificial intelligence topics and management and business approach. So the first 3-4 months, you're going to be discussing these business issues, and the second period, basically from January through March, we're going to be in Saint-Etienne and here, but we're going to be having visits from professors from Saint-Etienne, Saint-Etienne Engineering School, where they will be bringing their technical part. Technical part is the development of the here we have some openings here, the topics on medtech, the topics on Python, a little bit of programming as well, applied analytics, in the interaction with AI devices, and many other courses. So how was I ask maybe two questions for our one to Benjamin, basically what is the because I mean you manage the Saint-Etienne technical part. What is the main lesson that they should keep from that period? And I will ask Uzma, what was your challenge and your favorite course in the second period of the program? So, Benjamin.
Yeah, on these aspects of technical solutions and what to do and how to use what already exists, okay, on the market as technology, okay, to process data and solve kind of healthcare related issues. It's to challenge the students on what to use and reflect on these technologies, on the different, okay, issues they might have, okay, what is okay, what is not from an ethical point of view, from a technical point of view, okay, because we think a lot of things about AI technologies, okay, it's kind of great, it can do a lot of things, but there are also a lot of things that they cannot do and that they shouldn't do. And what we want is to really give the students, okay, the ability to critique these technologies, okay, to say, okay, we have these issues, okay, we have these technologies that we can use to actually address these issues, but we have to remain aware that we might have these kind of problems, that we can create this kind of discrimination, and so on. So it's really to give the students this, again, 360 vision on what is possible, what is not with the current technologies, and what will be the next challenges, okay, because you, the students, the next candidate will be these professionals that can say, okay, we can use these techniques to address this thing, but we cannot use these ones for these reasons, from legal reasons, from ethical reasons, okay? So if there is one thing that students has to remember is to make the distinction between what is okay and basically what is not from many perspectives, legal, technical, and so on, I would say.
Uzma, what is your highlight or your moment?
So for me, the challenges in the second term were the technical subjects, I would say, like interacting with AI, applied data analytics, Python. But on the other side, they were very interesting because it basically gave the real world scenario that, okay, how when you are managing a company or when you are going to manage a health tech or a med tech device, you should know how it works. Only then you will be able to tell your colleagues or work with your colleagues on certain aspects of improving your product. So that was the highlight. And I would say interacting with AI and omics and nanotechnology were my favorites in the second semester, mainly because I'm more interested in the image processing part. So interacting with AI, it gave me perspectives and information about how it works in the real world.
Thank you. Excellent. So on the slide, maybe to explain a little bit the layout of the timeline, we have let's see if I can show with the pointer. So we have the main courses here with transforming early makers and the main business courses then normally in December we place an international week that could be, in a very important city in the world linked to digital healthcare. We have been to Boston. We have also done exchanges with Berlin and with Nuremberg. So, and with also soon enough with Estonia in Tallinn. So basically, we are trying to find locations that are very expressive of the use of technology in digital healthcare. The second part we see here in the middle, basically from January through March, it's the technical part, what we call the P2, the second part, and then we have the Shanghai destination that normally is a third period that is normally highly international, right? This year we're going to have our students enjoy a period in Tallinn, in Estonia, in a Taltech technological institute, where in Tallinn, where they will be able to learn and apply and discover basically the way other countries apply these digital solutions. By the end of this period, there is going to be also a sort of a consultancy project that is going to be happening during that Tallinn period, and then you have you go into an internship basically from 4 to 6 months, and while you do that internship, you're going to be preparing your graduate thesis. And then once you prepare and you finish and present that thesis, you will be graduated. That's normally around the month of February of the following year, basically 2 years later. So that's basically that. We also basically throughout the year, you will have a career services that is going to be accompanying you in terms of preparing and helping you to boost your profile, your LinkedIn profile, your pitch capacities. So that's everything happening all the time. There's many sessions with coaches and on demand, and also workshops and also meetings with companies that we had also many throughout the year, where you can basically talk to directly with companies, either physically or sometimes also online. And we have made many meetings like that. Do you remember any meeting, or you participate to meetings in that sense? And how was the feeling there, Uzma?
So I participated in the career fairs in the campus, and also basically the ones which were held only for our masters, only for the health domain. So all the companies related to the health technology, the medical devices, they were participating, and I spoke to the HRs, and they gave some insights about the company, the culture in the company, how to apply, and so on.
Excellent. Here we're sharing some images and information about the international trip that we do every year, and also basically when we go on an international trip, which is basically around 7 to 10 days, we try to visit companies, to visit professionals, to visit startups, to see the digital healthcare ecosystem on the site, and also benefit from networking operations or situations where you can basically learn how to interact with other professionals and sometimes academics, sometimes of course potential people that might recruit. So that's the main points of this program. We can go back maybe quickly to the idea of the prototyping, or how we did this process of prototyping a digital healthcare solution. Maybe a quick question to Uzma. What was your case? What was your prototype case in this Transforming Early Makers this year?
So basically, our Transforming Early Makers was about remote medical monitoring. So we initially started with the idea of performing robotic surgeries, and we were doing brainstorming and trying to gauge ideas, and then we narrowed down to remote medical monitoring in space and also on Earth for isolated populations. So we had basically linked all the wearable health devices. So instead of having just one Apple Watch, or let's say just one Withings watch, our algorithm could link all the 4 or 5 devices and then give an output or the result to the patient or the user who is wearing it.
And were you able to not necessarily prototype a device per se, but you were able to achieve a sort of like a summarized version, right?
Yeah. So we made a business model. We saw how it would work, and we spoke to the people in the industry, where to store the data, how to basically how to go about it from the beginning till the end. So it was.
Yeah, it's interesting that in that sense, because the different talks that we had and the approaches with different people in the industry allowed you to see the different angles that would apply for each for the topic. Benjamin, what was your high point in the development of this, or at least how was your? No, I change the question. Between the design that we had, basically, between the creation of this project until it came to fruition, because it came from like a conversation, basically probably like a year and a half ago. What was your, what do you think, how do you think it laid out, and what was your basically feeling about this development?
Yeah, at the beginning, when we thought about this, we all have our, let's say, perspective on the question. We say, for example, behavior analysis, then I have my idea, Francois has his idea on what type of product. But if I can emphasize on something, it's really, again, like the background of the students. We have basically as many backgrounds that we have students. So the path and the device that is created is the result of a combination of backgrounds. And if you're, I don't know, like a dentist from India, if you're a physiotherapist from Spain, or if you're, I don't know, an engineer from Canada, or I don't know, pharmacist from Lebanon, then your perspective and your vision of the question is like totally different. So we are we don't know what to expect from the students, because it's going to be different from what we have in mind. So the key point is really from this process, I mean, whatever the topic you're assigned to, I mean, the process to get there is basically the same. Then you have to define the needs. This prototyping process, yeah, you define the needs, then you know, okay, I want to address that, then how, from a technical point of view, I will address that. Okay, sure, I got this. Then finally, how will I put this into the market? Who will pay, and so on. So I would say that like the key part is between this need identification and this concept, which is like super, I wouldn't say like exhausting for the students, because they have a lot of going back and forth from the idea, yeah, let's try this. Okay, no, it wouldn't work. So let's go back to the needs identification and so on. And that's really where this creative thing happens, all right, where we have a lot of ideas, the students have a lot of ideas, the coaches have a lot of ideas. I mean, we are not astronauts, so we are our limitation in terms of content and of projections that as a group, okay, we can fit in. And I think the main part is basically this particular point, how to benefit from the other guys of your group, okay, to make the best of the technical aspect that you have, maybe the backgrounds you might have in innovations and so on, to build the best device. That's, I mean, if I were the students, I would enjoy a lot like this particular part. And as a teacher, this is actually what I like the most.
One quick question to Uzma again. I'm sorry to ask you, but this is probably the highest value is coming probably from you. And two questions basically: how was the combination of profiles, basically, or backgrounds, in the process, in the fruition of process of creations, of prototyping something, and both backgrounds, technical and also different nationalities? So how did it feel to work with people from different backgrounds and different nationalities?
So we were a group of 5, and all of us had different backgrounds completely. all five, none of us had a similar background, different nationalities. And when we were working, so there are different aspects of a project. There is a business aspect, there is a scientific aspect, there's a technical aspect. So each one had a different role to play. If I could bring something to the table, the other member would bring some other specialty. Then the third person would bring something else. So each one of us had to bring something to the table, and each one of us were learning from each other as well. So not just the lectures in the class or the work in the class, but we were learning from each other, and someone was good at something else. So they would again basically teach all the others. So it was like that. It was a collective intelligence, I would say.
Mm-hmm. Were you able to question yourself throughout this process, basically saying like, I shouldn't be so, I don't know, stubborn, but basically fixed on one idea, right?
Yes, yeah. Because in the beginning, when we were doing the process of ideation, there were so many ideas coming into the mind. And if the other team member has a different perspective of, it basically broadens your horizon, because I have seen, I have certain amount of experience in certain things. So I'll see a particular project in one way, but the other person again brings a different perspective. So it makes you curious to know about others' perspectives too. So it's good to learn and to be curious, as Benjamin had said in the beginning.
Yes. How was the program is taught in, you know, face-to-face in Écully, Lyon? How's been your life in Lyon so far, and what is your recent, you know, how do you feel about, you know, Lyon? What do you think about the city, or, you know, its vibe?
Lyon is my first choice. I wanted the program to be in the campus and not online, because that gives you an edge, and you learn. I feel when you're into the system, I mean, you learn with interactions. So that was my first preference. And Lyon is a hub of most of the medical startups and most of the big pharmas. So the speakers that we got in the campus, the coaches that we got in the campus, since the location of Lyon is very favorable for all of them to come into the campus.
Yeah.
And some of the lectures we had online, since the professors and the speakers were out of the country. So that's a different case. But since Lyon is a center, and it's a very beautiful city to live in, so it's very peaceful. Yeah.
Yeah. We on that note, we had we have a set of permanent permanent faculty in the campus in Écully, Lyon. I mean, I'm professor here in the school, and we benefit from these consequences of, you know, getting used to teach online by inviting a lot of guests from anywhere in the world at any time, basically. So we had a lot of flexibility in that sense. So basically, we have maximized the amount of time and contact with both with students as well during this year, this last year. So it was very, very interesting. We were able to move forward very fast. So we are approaching the 45 minutes. I don't know, Lavinia, if we are okay in terms of time.
Yes, you do have a couple of minutes still, if you want
Good.
to close up any topic.
Of course. I mean, I would like that we could, if we could have a chat or a good conversation now. I wouldn't want to drive your questions. I was like, try to ask any questions you want about the content, about the methodology or the approach. I can tell you that the program is, I wouldn't say a roller coaster, but it's filled with emotions, because it starts with a lot of you know, excitement and confusion at the same time, because you begin to do things that you're not used to do. And I think as you move along, as you advance in the months, you will discover that you have more and more control, management, and, you know, you get the hang of things, and you feel more confident of yourself. That's important. And I think working with Mines Saint-Étienne has been a wonderful thing, because we have had a lot of interesting approaches and lessons and excellent professors from there. And also Saint-Étienne is a beautiful city. And so Benjamin, do you want to close with your thoughts about how important the school and how important this sort of joint venture in this program has happened, and the years to come too.
Yeah, I mean, we've shown you basically like the process of prototyping something, but I think like the program is also kind of following the same kind of process. First semester, it's a lot of immersion into healthcare, what the challenges are, what kind of innovation is possible. So basically identifying like the real needs in the world, basically about healthcare. And then second semester is basically diving into the real technological stuff, basically the whole spectrum of data intelligence technologies, what you can do with that, how to understand how it works, and so on. So, and to finally in the third semester apply this is in another environment. So really this process might be a little tough at the really beginning. Okay, I have to do a lot of things, but I don't have these background, the skills, and so on. Yes, wait for it. I mean, it's gonna come little by little. So at the very end, you see the whole picture, and then you have the tools, and you understand the challenges, and you know basically what to do and when to do all this, both in the French/European environment, but also perspectives on the American market, but also with Asian market. So that's really what we aim for, and that's the philosophy, let's say, about this 360 skills/vision that we want to give to the students. Be really, and I will maybe end on that part. This program and this idea of what we do and how we do it is not just popping out of our head with Florencio. Has been created from real need from the market. Okay, these guys in companies that basically told us, okay, we have good students, good business students, we have good engineering students, but we need kind of an hybrid student that could handle both sides. We need people understanding the data, understanding the technologies, and understanding the challenges that are related to healthcare, and that's actually what we do. Okay, is to provide the market with these kind of new skills. Okay, hybrid skills. So process related, but also skills related. This is a dense year. Be sure of that, but with a lot of things to came out from at the very end.
Thank you. Thank you, Lavinia.
Thank you so much, Florencio, Benjamin, and Uzma, for your very interesting presentation. So we did get a couple of questions, and I would like to get to those. But before I do that, I just want to thank all the participants who have stuck with us till the end. And of course, if you have any questions related to this master, to Uzma's experience, feel free to type them in the Q&A box, and we will be more than happy to, just answer them and clear all your doubts regarding this program. So Sagan is asking if it's possible to join the program 100% online. And I know you mentioned this in your presentation, but perhaps you can repeat that. And when is the session? And I think they mean when are the admissions opening?
We can hand it over to Charlotte. I think she will be able to reply both, huh?
Yes, sure. Thank you very much, Florencio, for the question. So regarding the program being able to be done online, unfortunately, it is not. As you've seen from everything that Florencio, Benjamin, and Uzma have told you, it is paramount that the students are on site with us to get the best academic and outside of classes experience. So unfortunately, this program is not able to be done online, and I don't think it would be the same, and it would give you the same experience. Would it happen online? Regarding the second question, can you remind me what it was?
When are admissions opening?
Sure. So technically, applications are already open and are on a rolling process basis up until the end of the summer. However, it is on a first-come, first-served basis, and especially in this current climate where we have, health management is kind of a hot topic, fortunately or unfortunately, depending on how you want to look at it with the COVID situation. So this program is quite well seen by a lot of applicants. So I would strongly recommend that you apply as early as possible. because we receive a lot of applications, and for many programs, applications may close early. So you have several rounds of applications that happen throughout the year, all one after the other. The current round of applications will close on April 11. So if you wish to apply and to take the time from now, March 22 to April 11, you would have a good enough amount of time to make a good application, to apply, and to have your application results by around mid-May, which, especially if you are abroad, would give you all the necessary amount of time to know, okay, you are now admitted. If you are, how to best prepare for your visa, how to arrive in France, and it will give you all the necessary time to be able to do all that. If you're not able to apply before April 11, do not worry. There is another round of applications after that that will close at the end of, on May 18. So I would strongly recommend, especially if you are from abroad and you need a student visa to come to France, that you do not wait too long. Otherwise, it will be a very stressful summer for you, running, finding housing, and doing all of your visa procedures at the same time.
Thank you so much, Charlotte. So we do have a follow-up question to these previous ones. So Sagan is asking us if it's possible to know more about the admission process and more about the fees or any waivers that are available as well. Thank you, Charlotte.
Sure. So we'll talk first about the cost of the program. So the Master of Science tuition fees are set at 24,900 euros for the full time of the program. So this is an 18-month-long program that will provide you with 120 CTS credits. Obviously, at emlyon, we recognize that for some students, the tuition fees can be a bit steep. Which is why we've put in place scholarships in order to be able to help students who may need it attend our programs. And so this goes also for our Master of Science in Health Management and Data Intelligence. We have two kinds of scholarships that you can apply for. The first one is what we call the individual scholarships. So this is an application request that needs to be done at the same time as your application. It's in a motivation letter type format where students have to answer 3 types of questions. And this individual scholarship is based on the diversity of that the student brings to the class, obviously the academic excellence of the application file, as well as the student's needs, financial needs. So is an application that needs to be put in your, this is a scholarship application that needs to be added to your application file, and the individual scholarship can range from 5% deduction from your overall tuition fees all the way up to 30% deduction. On top of this individual scholarship, the students who have or wish to take a GMAT or a GRE and have a good score can provide us with a score, even though providing a GMAT or GRE score is not mandatory for the application process. If you've taken it and have a good score, we will reward you with an excellent scholarship. For example, if you get a 650, you get an additional 5% scholarship, and if you get a 700, you get an additional 10% scholarship. So all of those obviously are the emlyon inside scholarship opportunities. But if you have opportunities from outside, from maybe your own government or from private organizations or associations, do not hesitate to also look up those options to help finance your studies. Obviously, emlyon also has partnerships with partnered banks and with Prodigy Finance, who is set to help international students to finance their studies with loans at preferential rates when they come to the emlyon business schools. So we have all of those different things in place to help you out. Now, to talk a little bit more about the application process. So the application process is twofold. The first step is your online application form. All of those steps happen online, so you will not need to come to Lyon to take a test to be eligible for our program. So first, we'll need you to provide us with your application file, which will just be a list of documents that we'll need in order to make sure that academically as well as professionally you fit the program. So we will need your CV updated in English. We will need all of your transcripts from higher education. We will need any diploma that you already have. And if you are currently studying in higher education, we will need your proof of enrollment in higher education. These are the mandatory documents. However, if you wish to add more oomph to your application and to make sure that it is as competitive as possible, I strongly recommend that you add in additional documents to make your application stand out. So those additional documents can be, for example, a GMAT or GRE score, or an English test score, or, and I would recommend those, a recommendation letter or two. Those can be academic or professional, but they definitely help the jury, the admissions jury of whom Florencio and Benjamin are part of, make a better decision regarding your application if you are able to provide those. If you are not able to, do not worry. We are also able to make an educated decision on your application without, but it always helps to put you in a better light. Once you have provided us with your application file, we will ask you to take the emlyon digital tests. Those tests are entirely in English. They will last for about 1 hour and a half and will be comprised of different types of tests. Professional immersion module type of test, where we will be able to test your behavior in a professional environment. You will have motivation-based questions, written and oral, in front of your camera, so that we can test your motivation, the fit of your career strategy and the program, as well as your English level. And then you will have logic-based questions where we will be able to test your ease and capacity of analysis. So overall, all of those tests will take 1 hour and a half. It will be done online on your computer from home, and based on both your application file and the digital test, the jury will make a decision regarding your admission.
Thank you so much, Charlotte. That was a very thorough answer, and I'm sure it was very helpful for the participants. So while we are waiting for some more questions, and I do want to encourage participants to make the most out of this Q&A session that is about to end. We still have a couple of minutes left. I would like to ask Charlotte if we can maybe pop a useful link in the chat. So, for example, a participant is asking if I were to enroll for this course, where can I start? So you just talk to us about the whole admission process. Perhaps we can direct them to a link to emlyon. So
yes, I'm doing it right now.
Thank you so much for that. And in the meantime, Uzma, I would like to ask you, while we wait for some more questions, what was the element that convinced you to apply to this program? So what was the unique value proposition that convinced you to apply to emlyon and specifically to this program?
Basically, I'm a dentist by background, and while working, I was also handling one entire clinic in my organization, and that's when the business side of things started intriguing me, and I basically started searching for programs where I could learn more about the business aspect of health. And when I was looking for it, I found the program of emlyon quite unique because it involved both the technology and the health domain. I just didn't want to do only like health administration or health management. I wanted something extra, which I could find only here. And when I was searching, I actually, to be honest, I didn't find many programs with a similar, the similar structure, I would say.
Okay, so that's a pretty strong point.
Yeah. So this was my motivation because I just didn't want the health. I wanted a combination of the two.
That sounds amazing, and I think it ties to the next question that we got. So a participant is asking what kinds of career outcomes can they expect with a degree of this typology?
So there are many. I think Florencio, if you want to answer.
No, go ahead, please. It's more important your answer, I'm sure.
Yeah. So it could be anything. It could be either a health tech company, you could go into a pharma sector, you could be an analyst. If you have a technical or an engineering background or a biomedical background, you can be a data engineer, or if you can be a product manager. You could go anywhere depending upon your interest, which you would find out during the course. So that could be once you start, you will get to know what your interest lies, and you can look for those kind of companies and you could start working there.
Thank you so much, Uzma, for your feedback. Florencio, did you want to add anything on top of that?
Yeah, basically we have been, I'll be brief, we have been seeing students going to startups as, of course, program managers or program, product management, small, also to consulting firms as, junior consultants and assistants in consultancy. And then we have seen people going to big pharma in many sectors, from legal to HR to business development to even we have seen people going to other continents, to Africa, basically to work on development of business access and business development on these different type of companies. And also we have seen part of our students going to this public sector, that is the Ministry of Health here in France. So basically we have seen an interest from all these, from these students, from this double, double characteristics. They are both business students and also they are technical students. So it is very attractive from a market perspective.
Thank you so much, Florencio. It does sound like it's a very versatile program, and I do hope that this webinar was useful for the participants that attended it. And I want to thank all of those who stay with us until this moment for their presence. I would also like to remind all of you and all of those that connected later that you will receive an email with the recording of this event. So if you missed any important information, just review the recording. And of course, I would like to thank also Uzma for her presence here tonight, Charlotte for answering all the questions relating to admissions, and Benjamin and Florencio for giving us all the important insight about this program and all the unique characteristics that are within this program. I would like to thank all of the participants for their presence, and I do hope that everyone will be safe. I hope I will see you all to the next webinar in partnership with emlyon. And for this event, I think that's all. Thank you all so very much for this event, and I hope to see you again soon. Thank you so much.
Thank you.
Thank you a lot.